Healthcare costs pose an enormous challenge and an enormous burden. Our largely private and job-based system of provision imposes substantial costs on both American workers and their employers. And the inflationary spiral in health costs, especially as we look to the future, is the single most serious threat to the solvency of federal and state finances. This graph offers a quick snapshot of U.S. health spending since 1960. The left axis and blue bars plot the dramatic increase in per capita or per person health spending. And the right axis and red line plot the corresponding increase in the share of gross domestic product devoted to health spending, now, in 2010, approaching 20%. In part, rising costs can be explained by our relative wealth and by the availability of new technologies and new treatments. We spend more because we can and we want to. But a survey of our peer countries punctures this as the sole or best explanation. This graph plots public and private spending on health for the member countries of the Organization for Economic Cooperation and Development. The share between private and public spending varies, but most OECD countries accomplish near universal coverage for between 6 and 10% of their GDP. The OECD average is just over 8%, and even among those spending more than the average, the US is a stark outlier, spending as much in private dollars as the total spent by most of their peers, and then as much again in public money, for a total bill nearly double the OECD average. And this price tag is doubly troubling if we consider that the US is alone among its peers in allowing nearly a fifth of its population, almost 50 million people, to go without health insurance. Finally, we need to ask ourselves what we're getting in return. This graph plots 175 countries according to life expectancy of birth, the vertical axis at the left, and per capita health spending, the horizontal axis at the bottom. Much of the developing world is clustered along the right axis, with very low health spending and wide variations in life expectancy. As we move along the trend line, from left to right, life expectancy improves, but most of the gains come with the first $1,000 of health spending. Many countries, Bolivia for example, accomplish decent life expectancy at very low levels of spending. Others, Cuba, push near the top of the life expectancy curve without spending much more. The more developed countries and health systems, Finland, Canada, boast high life expectancy at levels of spending near the OECD average. Again, the US is an unfortunate outlier, with little to show in the way of outcomes for dramatically higher rates of spending.